importance of mother's own milk, common breastfeeding challenges for the baby's growth. Every baby, it's the every baby child right, birth right is gold standard of infant nutrition. It contains all the essential, almost all of the essential micro and macronutrients and diet substances which are necessary for optimal development of the baby, of an infant. I'd like to talk something about the breast anatomy. First, there is a multiple tiny grape-like structures with the milk secreting cells, which helps in the production of the milk. And these are milk is produced in response to the hormonal response, mainly prolactin. It helps in the secretion of the milk. And surrounding this is the myoepithelial cell, and this is also under the influence of the hormonal control, mainly the oxytocin. If there is increase in oxytocin, it makes the injection of this produced milk through the stomach, and the milk gets collected within these lactiferous sinuses, and as the baby suckles, then the milk starts to pour towards the mouth of the baby through a small pores at the tip of the nose. So mainly in physiology, there are mainly two hormonal reflexes, which includes the prolactin reflex. As the baby suckles, the sensory stimulus from the breast, from the nipple, it is sent to the anterior pituitary, and from the anterior pituitary, the prolactin is being released. And with this increase in prolactin secretion, it causes the increased production of the milk within the alveoli of the breast. And these prolactin, they are more secreted during the night. The mothers will be encouraged to feed more during the night. There are some enhancing factors. The early initiation of breastfeeding, good attachment and sucking, frequent feeding, including the night feeds, and the frequent emptying of the breast. Similarly, the hindering factors for this reflex includes if there is delay in initiation of the breast, or if we introduce any pre-lactal feeds, bottle feeds, or if there is incorrect positioning, or if there is painful breast. So, if there is any hindering factor, then the oxytocin reflex, similar to the prolactin reflex, as the baby suckles, the same sensory impulse from the nipple is sent to the posterior pituitary, and the oxytocin hormone, it is released from the posterior pituitary, and this oxytocin, it is mainly responsible for contraction of myoepithelial cell within the breast, which cause ejection of the milk. This reflex, it is enhanced if a mother thinks of loving of the baby, or from the sight, or from the sound, or if the mother is also confident. So the confidence is necessary. Building the confidence within the mother, it is necessary for successful feeding. And this reflex is hindered if there is a worry, or if there is stress within the mother, or breast pain, or if the mother has any doubt. Another factor is if the breast remains full of milk, then there are inhibitors within the milk, the proteins, or the feedback inhibitor of lactations. This inhibits the further production of the milk, which have negative impact in the production of the milk. So the mother should be encouraged to express frequently, and also it will help to decrease the discomfort as well as the engorgement. The other reflex necessary are the feeding reflex, such as rooting, sucking, and swallowing reflex in coordination with breathing for lactation. So what are the advantages of breastfeeding? The breast milk, it contains all the essential nutrients, that's macro and micronutrients, which are essential for optimal development of the baby. It it is easily digestible and it is ready to soft food. It also helps to protect against the infection. From the acute respiratory infection, the 4 times, and from the other infections, the 3 times. Similarly, it also protects against the allergic diseases like asthma or eczema. It also reduces the risk of obesity. And also, it protects against the adult onset diseases such as diabetes, hypertension. Uh, Similarly, it helps in the bonding between the mother and the family with the infant. The breast milk, there are also certain substances which enhances the gastrointestinal maturations, helps in brain and visual development. The baby also tends to be more smart and have higher IQ than those who are not breastfed or fed with other formulas. IQ point increases by around 8 than those who are not breastfed. Similarly, it is cost effective, and the certain advantages to the mother. It also includes the close bonding between the mother and the infant. It also decreases the risk of postpartum hemorrhages, thus decreases the risk of anemia. It also delays the next pregnancy. There is also reduced risk of breast and ovarian cancer, as well as the risk of diabetes, hypertension, as well as postpartum depression within the mother. It also protects against the obesity and helps the mother to gain pregnancy weight. Similarly, the advantages to the family, there is economic benefit, as no any formula feed or anything has to be bought for feeding the infant. Also, there is less illness. Similarly, there is increased bonding between the family and to society. It's eco-friendly, as there is no any waste material obtained, and also there is increased human resource development, which can efficiently contribute to the economic development of the nation and to the society. So, what are the disadvantages, or what are the direct or indirect risks of not breastfeeding? The risks for the premature and low birth infant, it includes increased risks of necrotizing enterocolitis, increased risks of retinopathy of prematurity, increased risk of sepsis, increased risks of bronchopulmonary dysplasia. Also increases the length of stay within the NICU. For the healthy term, there is risk of decreased IQ, increased risk of diarrhea, death in life, similarly the respiratory illness, ear infections, and childhood obesity, and also there is increased risk of sudden infant death syndrome. And exclusive breastfeeding till 6 months, only it has found the study has shown that the breastfeeding alone is one of the preventive interventions which can reduce at least 13% of the under 5 childhood death. Now, I'll be talking about the counseling, planning to initiate the lactation after birth. Lactation, it should be initiated immediately following delivery. WHO and UNICEF, it recommends initiating the breastfeeding within 1 hour of delivery. Also, the small and preterm newborn can start within this period, as although they are not able to suck, but suckling also helps to increase the milk production. If there is inability to breastfeed within 1 hour, then mothers should be encouraged to support and begin the breast milk expression. And the breast milk expression, it should not be delayed for more than 6 hours, as it can cause discomfort and involvement. Here in this, the supported from the back to the forearm of the mother, and the head is put at the arm of the mother. Second position is called the cross cradle position. It is similar to cradle position, but there is a slight difference. The opposite hand is used to support the baby's back, and the other hand of the mother, it is other hand of the mother is used to guide the nipple towards the mouth of the baby. These position is mainly useful for small and preterm newborn who have difficulty in attachment. The third position is the sideline position. The mother and the baby lie side to side facing each other. This is a comfortable position for the mother. This position is mainly suited for the mother after a cesarean delivery. The other position is the underarm position. This is also called the frugal position, in which the baby is held at the side of the mother body, and the body of the baby is tucked under the arm of the mother. This is also mainly suited for small and preterm newborn for feeding. Similarly, it can be used after the cesarean section delivery, as there is in cesarean section there is abdominal injury, and also this position it can be used for the twins. And the other position is the cross-cradle position. It is mainly useful for the twins. There are 4 key points of the good positioning, which includes the head and the body of the baby. It should be in a straight line, and the body should be well supported, not only the head and the shoulder, and the tip of the nose of the baby should face opposite the nipple of the mother, and the baby's abdomen should be touching the abdomen. Here in this video, we'll be seeing how to breastfeed the small babies, especially the preterm babies.
Position your nipple further back in your baby's mouth. Here, your nipple will be comfortable, in contrast to the nipple in a shallow attachment, which is pinched against the hard roof of the mouth. Your baby will also get plenty of milk.
You see, engorgement, it generally presents at around 3 to 5 days, and it presents as there is the breast becomes tender, and there is a taut skin, there is redness, throbbing pain, and sometimes you can also have low-grade fever. And for prevention, what we can do first is the correct positioning and attachment, and try to breastfeed immediately after the birth, and breastfeed on demand. Allow the baby to finish the first grade first before switching into the next. Other common problem is the clogged ducts and mastitis. The symptoms of the clogged ducts, it includes there is a localized tender redness. However, the mother generally feels well, and generally there is no fever. Whereas in case of mastitis, generally the mother has flu-like symptoms. Generally, the mother doesn't feel well, and the mother has fever. On examination, what we find is the redness in the wedge-shaped area on the breast, which is red, hot, and warm. And again, in order to avoid for the prevention, what we can do is, again, we should focus on the positioning and attachment. Also, breastfeed on demand, express the milk more frequently, avoid wearing the tight clothing. We can also try some various positions to rotate the pressure points on the breast. So for treatment, what we can do is we can gently massage the affected areas, and also we can do hand expression For pain relief, what we can do is we can put on the ice on the affected areas. And if the mother is expressing less, then we should encourage her to express it more frequently. And
If there is no improvement after 1 day of treatment, if she has a breast infection, she is ill. She shouldn't work. She should stay in bed, drink plenty of fluids,
bones and facilitate the decision-making process, and also try to involve the family. आमालाई that माधुरी दीक्षित आफ्नो बच्चालाई आफै दुध खुवाउनु भयो अनि उहाँले डोनेट पनि दुध पनि डोनेट गर्नुभयो, या something like that. Yeah. The fourth is to repeated experience. Yeah, encourage the repetition of the positive behavior. So it will help them to reinsure or to donate more, or also it increases the breastfeeding rate. Yeah. And similarly, we can also counsel them about the impact of anxiety and stress, which can negatively impact the breast milk production. Similarly, we can counsel about the exclusive breastfeeding. Similarly, we should counsel them about the breastfeeding frequency, durations. We can counsel about the frequent milk expression in order to prevent the discomfort and engorgement. Similarly, we can also counsel them how to monitor the baby's health indicators such as urine frequency. Similarly, the weight gain pattern, that is at least 500 gram per month, or baby's weight doubles at around 5 months and triples by around 1 year. We can counsel them about how to properly empty the breast in order to maintain the breast milk. Similarly, we can also counsel. We should also counsel about the correct positioning and attachment. Also, encourage the mother to learn milk expression technique and safe storage method. We should also advise for frequent nighttime feeding, breastfeeding. And every mother should be counseled for the milk donations. It can be started from the antenatal period also. Okay, and motivate every mother to donate any extra amount of the milk that is being produced after feeding their own babies to the needy ones, needy newborns and infant. And try to address any concerns or if there is any confusion, and encourage every mother for participation. Also explain the process and benefit of milk donations. And always while counseling, try to involve the family, as family support is necessary in order to keep the mother healthy and happy. Similarly, the counseling the families to build support. We can counsel the families for the support of the mother throughout this pregnancy, delivery. There are some common misgivings which should be resolved: normal delivery and third in cesarean section. Initial milk should be discarded as it is unhygienic. If your mother has any fever or allergy, the baby shouldn't be breastfed. The breast milk shouldn't be expressed in front of anyone, or the baby needs extra amount of water, mainly during the warm or the summer season. And how we can improve this awareness is by through the use of posters, leaflets and videos. We can talk about the benefits of breastfeeding, how to have proper attachment positioning, proper positioning, attachment. Also, how we can tackle the breastfeeding challenges through this, and also encourage about the milk donations. Yeah. Okay, thank you.
Like, share and subscribe Renika.